Today's ICD-10 quick coding tip covers an important guideline update regarding coding for asymptomatic individuals who test positive for COVID-19. My name is Claire and I'm an inpatient coding auditor and educator. In my quick tips and tricks videos, you'll discover valuable insights to help sharpen your medical coding skills and code with confidence. If that sounds like something that would be helpful to you, please consider hitting that subscribe button so that you can be notified whenever I release new content. CMS recently published an update to the fiscal year 2025 ICD-10-CM guidelines applicable for discharges occurring from April 1st, 2025 through September 30th, 2025. The guideline for asymptomatic individuals testing positive for COVID-19 has been revised effective for discharges starting April 1st, 2025. Prior to the update, the guideline states that asymptomatic individuals who test positive for COVID-19 are considered to have the COVID-19 infection. This means that while this guideline is in effect, code U071 for COVID-19 should be assigned based on provider documentation of a positive COVID-19 test result. According to the new guideline, which again goes into effect on April 1st, 2025, for asymptomatic individuals who test positive for COVID-19 and there's no provider documentation of a diagnosis of COVID-19, query the provider as to whether or not the individual has COVID-19. A false positive laboratory test is possible, and it is the provider's responsibility to confirm the diagnosis and document accordingly. This means that coders should no longer assign U071 for COVID-19 based solely on provider documentation of a positive COVID-19 test result. Instead, the provider must document that the patient has been diagnosed with an active COVID infection, and if the documentation is not clear, we must query the provider. Keep in mind that code U071 for COVID-19 is classified as an MCC, so incorrect application of the guidelines could have DRG impact. So let's take a look at some examples. This first example compares how the same diagnostic statement of a positive COVID-19 test in an asymptomatic individual is currently coded based on the guideline that is currently in effect through March 31st, 2025 discharges, compared to how it will be coded when the new guideline goes into effect for April 1st, 2025 discharges. The diagnosis in the discharge summary states, of note, patient was found to incidentally test positive for COVID-19. The patient is asymptomatic. Under the old guideline, effective through our March 31st, 2025 discharges, U071 for COVID-19 would be assigned. However, under the new guideline, effective for discharges April 1st, 2025, the provider would need to be queried to clarify whether the individual has an active COVID infection prior to code assignment. Now let's take a look at an example where we could code the COVID-19 infection without a provider query. The diagnosis in the discharge summary states, of note, the patient tested positive for COVID-19. The patient is asymptomatic, but they reside in a nursing home where multiple residents have recently tested positive for COVID-19. The patient was placed in isolation, and due to the patient's risk factors, they were treated for their COVID-19 infection with remdesivir. Under the old guideline effective for discharges through March 31st, 2025, U071 for COVID-19 would be assigned. Under the new guideline effective for discharges April 1st, 2025, U071 for COVID-19 would still be assigned. In this case, the physician has made it clear that the positive COVID-19 test result represents an active COVID-19 infection and treatment was given, so no query would be needed. So that's it for today's quick tip. I really hope that this video was helpful for you. If it was, please give it a thumbs up, and if there's any topics that you would like me to cover in the future, just leave a comment below and I'll add them to my list. Thanks for watching, and until next time, happy coding!